I'm Alan Roberts. I'd just like to introduce myself. I've been working with the overseas doctors for a long time, 30 to 40 years, running bridging courses for the doctors, preparing for the Australian Medical Council examinations. Plus, I also teach at Melbourne University, been teaching for the local medical students, mainly working with the 4th, 5th and 6th year medical students, doing sessions on site in the clinical sites and doing it on the wards and doing lectures to the full cohort of students. So the sort of things I deal with I'm dealing with the local medical students is dealing with sick patients and aggressive patients, patients who won't talk, patients who talk too much, all of that sort of thing. And when I'm working on the wards, I'll usually work in conjunction with a consultant, where the consultant will deal with all the medical aspects and I'll deal with all of the communication aspects around the case presentation, maybe the communication problems, the emotional intelligence problems. And my training is psychology, not medicine, but I've been involved with the overseas doctors for a lot longer than what I have for the local medical students. I'll take you back to the beginning. That I was working at Victoria University, and I was being involved in a course where the overseas doctors were preparing for their first step of their exam. So at that stage, when doctors were sitting the AMC exam, the pass rate for the MCQ was about 10%. No one knew what was going on, no one knew what to study, any of these sort of things. And so after passing part 1, which is their English exam, then there was nothing else. No doctors knew where to go, what to do. So I started to have a lot of doctors coming to the course. So I then decided that I would try and organise and start running a program preparing overseas doctors for the Australian Medical Council Part 1 exam. During that time, those doctors, when it was a little bit lucky, we got some funding to run the first course, and at that stage I told you that the pass rate was about 10%. So we ran the first course. In that course, the doctors were lucky that they got a book allowance, they got a training allowance, they had their exam fee paid for them and all of those sorts of things. So there was a big demand for the course. So I ran a course out with 20 doctors. In the very first course we ran, remembering 10% was the pass rate before that, we ran a course for 20 overseas doctors. And out of that 20, 17 passed the AMC Part 1 exam after doing a course. So it showed that if you gave the doctor support, then there was a good possibility that that would enhance their chances of passing the exam. So after that, then the government came in and they started funding these courses, and they were all set up all over Australia and they were running. And then the AMC decided they put a quota system because they thought there were going to be too many doctors coming in. So they made it that there were only 200 doctors being passed per year. So the government body that was funding the courses said they didn't think this was fair, so they stopped funding the courses. So all the courses eventually died everywhere all over Australia, but we kept the one running in Victoria. And it was then had to be switched from being a funded course to a fee-for-service course. And that's what you've got today. And this new style of examination is 150 questions, 30 of them are research questions, and you're marked on the 120 questions. You don't know which are the research questions, and you don't know which are the ones that are going to be marked. Only that you're told that you'll be marked, the last 20 will be marked. So it's important time management, it's important with this. And also, the thing is, you need to, I'll give you an example. If you're having a question where you start and you answer A, and A happens to be wrong, whatever the topic is, the paper will think, okay, the doctor doesn't know this topic very well, so they'll ask something a bit easier and related to that topic later on. And if they get that wrong, it looks like, okay, they don't know that topic very well, so they'll move on to the next topic. But just say the second time they got it right and say, okay, that doctor does know a little bit about this topic, so they'll ask them something harder again. And then if they know that, they'll think, okay, they do know a lot about this topic, they'll ask again. And if they get that right, it says, okay, they know this topic, let's move on. So one doctor might come out of this exam and they might say, Alan, look, you know, when I did this exam, I had lots of orthopedic questions. But the next doctor will say, no, I didn't have many orthopedic questions, but I had lots of neurology questions. The reason being, it means that the exam paper is trying to decipher whether you're going to pass that section or not. So it's a very sophisticated exam. Very complicated exam. But the way that we teach you with this course, it doesn't matter really what, because we're teaching clusters. So it doesn't matter what they'll dish up for you, you'll be prepared for it. Because no matter where you're asked, it'll take you along that line. So you'll be very well prepared for that exam. And many doctors say to me, well, and what's the secret of passing this exam? I'll tell you the secret about passing this exam. The secret is hard work. You put the work in, we'll give you the tools, we'll prepare you we'll give you all the mechanisms you need to give you the best chance to pass this exam, but you need to put the work in. You put the work in and you'll get through this exam. If you go to the AMC website, there's probably 100 books there. You don't need these books. I think what you need the AMC handbook, which is difficult to get now. But there's then there's the John Murter, the GP practice book. That's a good book for you to have as well. And then I always find that the Oxford handbooks are useful. Like when I'm dealing with the local medical students, many of those students have those Oxford handbooks in their jackets because they're very good books. And then you'll get all the advice you need about any other books that you might need. You'll get that from the course. To sit the AMC exam, you'll need an AMC number. But to do the course with ARIMGSAS, you really don't need the AMC number yet. You only need an AMC number when you're actually going to be sitting the exam. But it's a good idea to get that out of the way early, because it means that if there is any hiccup or any delay in you getting an AMC number, it means that you won't be able to sit the exam. So to get an AMC number, you need to do your EPIC verification. So the EPIC verification is if you want to, you can go to the YouTube. We've created a video for people to guide them through the EPIC verification. So it's just a matter of going to the AMC website and following the link there, and then getting your paperwork assessed and sent off so you can get AMC number at the end of it. Then you're eligible to go on and sit your AMC exam. After the MCQ, you can apply for any job as a doctor, really, depending on what your qualifications are and what work experience you have. So once you've passed your MCQ exam and you've got your English, then you're eligible to apply for any HMO or RMO position in Australia. That means it would be a HMO2 position or RMO2 position. Now then, depending on your experience, if someone has got a lot of experience from their country of origin, then you would be able to I've had some doctors apply for a registrar's position and get them, but that's a lot of responsibility. So you have to be quite an experienced doctor to be eligible to apply for one of those positions. Then if you're talking about general practice, then you are eligible also to apply for a general practice position, but usually someone that would be thinking about applying for a general practice position would have to have had at least 5 or 6 years of general practice experience in their country of origin. Otherwise, the registration won't go through. So if you've got that amount of experience as a general practitioner in your country of origin, and you've passed your English and you've passed your MCQ, then you are eligible to apply for those jobs. If you get one of those jobs, you'll be getting a job offer. Then after you've got the job offer, next requirement will be to do a pesky, which is an examination where you sit in front of three people, usually two doctors and someone from the community, and they'll ask you questions mainly about general practice. Once you've had that, then you'll come back, you can fail that exam, then you can get assessment of level 1, which means that you need to be supervised after every patient or during each patient. Level 2 is supervision at the end of the week. Level 3, which is supervision at the end of the month. And level 4, which is complete independence. In all the time that I've been working with the overseas doctors, I've only ever had 2 doctors get level 4, and both of those doctors had quite extensive hospital experience before they moved into the general practice area. You increase your chances of getting a job in Australia, in my opinion, for actually making sure that you've got a good CV, making sure that I think it's an enhancement if you've done a bridging course, because if you've done a bridging course, then I know that the hospitals and the general practices know that you understand what the Australian healthcare system's about. But it's very important for you to have a good CV. And then, even though I say this when we're doing our induction for all our courses, and then I see people's CVs after they've done their course, and some of them, it's unrealistic to think that you would be getting a job with that CV. So your CV needs to be good. It's like your business card. And so to have a good CV, it enhances it if you've done a bridging course, and of course you need to have passed the exams. It's also a bit easier to get a job if you've got some experience from your country, although I've got many fresh graduates come through, and if you are a fresh graduate, I would think that it's advisable to do the MCQ course and then get your clinical out of the way, and then you'll find that they'll take away any of the hurdles that you might have to go over to get a job without having any sort of experience in your country of origin. To get APRA registration, you can't apply for APRA registration. It has to be the clinic or the hospital that's going to employ you to apply to APRA. They'll do it in conjunction with you, but it needs to be done by the hospital or the clinic, and then there'll be you'll be guided through that process by the employment person or employment, the HR of the hospital or whatever. They'll guide you through the APRA application. About visas, a lot of the people that come in to do our courses, which is a good question because people think, oh, should they have a permanent residence visa to do the course? No, we have many people that come in on visitors visas to do our course, and then or they might be on a spouse visa or any type of visa, or even we have people that come in, they're doing a education visa. They might be doing a master's course with one of the universities, and then in their holiday break they'll come and do one of our courses to try and get through and prepare for the exams during their course at the same time. But I don't think there's any particular visa. The only thing is, when you've got a permanent resident visa, then it's more likely that you're going to be employed from the hospital. But then again, many doctors that I know, they'll be on visitor's visa, they'll pass the appropriate exams, then they'll pick up a job with a visitor's visa at a hospital. The hospital will sponsor them, or the clinic will sponsor them, and then the clinic and the hospital will assist them in getting changing their visa status from a temporary visa to a permanent visa. So WBA programs, that's the Workplace Assessment Program. If you want to know the hospitals that are involved in that, you just need to go to the Australian Medical Council website, and there's a list of the hospitals that are there. This was a program that was set up to give the doctors another avenue without going through the AMC process. So the workplace, and it's changed over the years. When it was first set up, it used to be free, but now there's a fee usually attached to the workplace assessment program, but it's a fee that you don't have to pay up front. What it is, because once you get into the workplace assessment, you start earning, and then the fee that you'll pay, the hospitals will take that out of the income that you're earning. So workplace assessment is a program where you're assessed by your peers. It can take anything, it usually takes up to 12 months, but recently I've known a couple of doctors that have got into the workplace assessment program where it's stretched out to at least 18 months. There used to be quite a few places, but now it's very competitive. Many hospitals have got long waiting lists to get into this workplace assessment program, but I find that if you're lucky enough to get one of those workplace assessment programs, if there are any issues along the way that need to be dealt with, then usually the hospital will go about giving you the support necessary to help you get over those hurdles. Whereas when you're going through the AMC process, you're virtually left on your own unless you've got an organisation like ARIMGSAS to assist you getting through the exam system. But the workplace assessment is, you need to have passed your MCQ, you need to have your English, and then they'll offer you you'll get into the workplace assessment program. After you've finished it, usually it takes between 6 and 12 months, then it means, and you get a positive assessment from your peers, it means you don't have to do the clinical exam. It's exactly the same recognition as what the AMC clinical exam is. In conclusion, and I know that it's all of these things, when you're immigrating as a doctor, you're thinking, you'll get into the system and things will change very quickly. But I know that it's a bit difficult in the beginning because, first of all, if you're joining any of the bridging courses, they're expensive and the exam fees are expensive. But once you get into the system and you get through these, I've got thousands of doctors, thousands, that are now gone on, and many of them are specialising. Many of them have gone on to be fellows in general practice. Many of them have gone on to own their own clinics. And, I can think of one fellow that we deal with all the time, one doctor. It was only maybe probably 10 years ago that he passed these exams. Now he's employing 200 doctors. He runs a big locum service and he's employing 200 doctors himself. So I've got many doctors that own 3 or 4 clinics now, many general practitioners, many that have gone on to be surgeons, consultants, in all the different areas, pediatrics, physicians, whatever, and they've gone on to specialise. And I think that I've even got 4 or 5 doctors have gone on to be full-on professors in different specialities in their programs. So in conclusion, I think, again, like when I was talking in the beginning, I think the one real thing that you need is to be prepared to work hard. If you've got organisations like ARIMGSAS that can guide you through the way, you put the work in, we'll give you the tools to give you the best chance possible for you to sit and pass this exam.